Good afternoon. We apologize for the brief delay. On behalf of the Office of the National Autism Coordinator and the Office of Research Coordination here at the National Institute of Mental Health, we welcome you to this afternoon's webinar session on making healthcare transition work for youth with autism, youth and parent perspectives, and national resources. My name is Frank Avanilla, and I'll be serving as moderator for this session. Before we begin, I just want to remind our listeners that your audio has been muted during the presentation. We encourage you to send your questions during the presentation through the WebEx chat box, and we'll address as many of the questions during the question and answer session as our remaining time allows. And now I'd like to introduce Dr. Ann Wagner, Director of the Office of National Autism Coordination at the NIMH, to introduce our presenters. Dr. Wagner?
Thank you. Welcome, everyone. I'm glad you could join us for this webinar. We're fortunate to have with us two experts on the transition from pediatric to adult health care who will describe important resources that can help facilitate a smooth transition process for everyone. We have two special guests who have personal experience with this transition. Today we'll hear first from Sarah Beth McClellan. Sarah Beth is a public health analyst in the Division of Services for Children and Youth with Special Health Needs in the Health Resources and Services Administration of the U.S. Department of Health and Human Services. Many of the programs Sarah Beth oversees focus on improving the systems of services that support children and youth with special health needs, their families, and communities. Then we will hear from Peggy McManus. Peggy is president of the National Alliance to Advance Adolescent Health and co-director of the federally funded National Resource Center, GOT Transition. With Dr. Patience White, Peggy led the revision of the 6 core elements of healthcare transition and developed numerous tools and processes for measuring quality improvement and consumer feedback, as well as numerous dissemination efforts. For more than 3 decades, she has directed federal, state, and private foundation projects on transition, adolescent health care delivery and coverage, children and adolescents with special health care needs, the pediatric subspecialty workforce, and public health program and policy development. Peggy will first introduce us to a mother-daughter team, Elisa and Lauren Ware, to discuss their experience making the transition from pediatric to adult health care. Then Peggy will describe several resources for health professionals, youth and families, and researchers and policymakers. So thanks again for joining us, and I am going to turn the presentation over to Sarah Beth McClellan.
Hi, and thanks to Ann and her team for really inviting us to provide a high-level overview of the Maternal and Child Health Bureau's work on healthcare transition for youth with special healthcare needs. And as Ann mentioned, my name is Sarah Beth McClellan, and I'm a project officer in the Division of Services for Kids with Special Healthcare Needs. Next slide, please. Next slide, please. One more. Thank you, and one more. Thanks so much. And the Maternal and Child Health Bureau sits within the Health Resources Services Administration, and as noted on this slide, HRSA funds several public health programs and really serves over thousands of grantees across the United States. Next slide. And one of the bureaus within HRSA is the Maternal and Child Health Bureau, whose mission is to provide leadership and improve the physical and mental health, safety, and well-being of all maternal and child health populations, including those with special health care needs. Next slide. And within the Maternal and Child Health Bureau is the Division of Services for Kids with Special Needs, which is where I sit. And our vision is to achieve optimal health and quality of life for all children and youth with special health care needs and their families by creating and supporting an effective system of care. And we define children and youth with special health care needs as those who have or are at increased risk for a chronic physical, developmental, behavioral, or emotional condition, and who also require health and related services of a type or amount beyond that required for children generally. And based on the most recent data from the National Survey of Children's Health, about 18% of U.S. children under the age of 18 have a special health care need, and only 14% of those children and youth receive care in a well-functioning system. Next slide. So what are we really trying to achieve? We're dedicated to strengthening that system of services for kids with special needs and their families by putting our focus and centering our programmatic work around the child, youth, and the family. Next slide. And we approach our work in thinking about that broader system that serves this population. And in defining and measuring that system, we use the following 6 core outcomes that are listed on this slide. And I'll read through those just very briefly. Early and continuous screening, access to comprehensive and coordinated care through the medical home, community-based services and supports that are organized and easy to use for families. Families are partners in decision-making, that there's access to adequate insurance and financing to pay for needed services, and that youth receive services necessary to transition to adult health care. Next slide. And for today, we're going to focus specifically on that last core outcome, that healthcare transition piece from pediatric to adult healthcare. Next slide. And at the Bureau, we're committed to integrating healthcare transition into several MCHB-funded programs. And I'm just going to highlight a few on this particular slide here, and those that have really taken on this critical work. And all of our healthcare transition work is anchored by our National Technical Assistance Center for Healthcare Transition, GOT Transition, who Ann mentioned a little bit ago, who you will be hearing from shortly. And this small yet mighty team provides technical assistance, training, research, and support to multiple entities and stakeholder groups at all different levels of the healthcare system to improve that system of care to support youth and young adults and families as they transition to the adult healthcare setting. Next slide. Also, I'd like to highlight the state Title V maternal and child health and children and youth with special healthcare needs programs. And these are state block grants that are funded under Title V of the Social Security Act. These programs serve maternal and child health and children with special needs populations. And as part of this program, states select performance measures that fit their identified population priority needs. And just this past year, 36 states and territories have selected the measure specific to healthcare transition for youth with special needs. Next slide. The Bureau also funds a program that provides interdisciplinary training to enhance the clinical expertise and leadership skills of professionals dedicated to caring for children and youth with neurodevelopmental and other developmental disabilities. And these LEND programs have incorporated elements of healthcare transition into their graduate level curricula. Next slide, and next slide, and next slide. Thank you. And I also just wanted to highlight that the division also funds several disease-specific programs such as epilepsy, hemophilia, and sickle cell disease. And these programs are dispersed throughout the country, and they're tasked to help the youth that they serve successfully transition from the pediatric to adult healthcare system. Next slide, please. Next slide, please. Thank you. And thank you. Next. And really here, to me, the most important thing to note is just that even though these programs that we fund are quite diverse in their goals and their target audience, they all have a shared commitment to, and you can keep clicking, thank you so much, partnering with youth and families and communities, collaborating with key stakeholder groups that are part of the broader system of services, and applying evidence-based practices to reach their goals. Next slide, please. So I'm going to stop talking so you can actually hear from the real experts here on this panel. My contact information is listed, so please don't hesitate to reach out and connect. And I want to thank you so much for having us.
Okay, we have Peggy McManus joining us now. Peggy, if you're muted, I think you need to unmute your line.
Yes, thank you very much. And my thanks to Sarah Beth and Ann and Frank for inviting us to partner with them and Elisa and Lauren Ware on this exciting webinar. I'm just going to launch right into this exciting introduction if I could, with the next slide, we have with us today Elisa Ware and her daughter Lauren. And I just have to tell you, Elisa Ware has done tremendous work advocating on behalf of parents through her work at Family Voices, and for the last several years has been a consultant to our program at Got Transition. She is also chairing our new National Family Transition Advisory Group, and she serves on our Executive Advisory Group. This Elisa Ware is quite busy in her spare time. She's getting her PhD, so hats off to Elisa. And we're very excited today to have with us her daughter, Lauren, who is a high school student and is actually a flutist and soon to be a music performance major. And I understand that Lauren loves cats and is very passionate about politics, and certainly what a time in history to be passionate about politics. So we are looking forward to this real-life exchange between mother and daughter during the transition period. So I'm going to ask a series of questions to Elisa and Lauren about their transition experience and their suggestions for parents and youth with autism. So I'm going to dig right in, if that's okay, Elisa and Lauren. I think you're on mute. Can you hear me now? I think we need the help of Frank and Ann to get the...
I think Elisa might be on mute, and we would ask her to...
Okay, I think I hear her. Great.
Great.
Okay, we're all connected. Before I start in on my questions, Elisa and Lauren, is there anything else you want the audience to know about you?
Anything else to know? I think you gave a really good explanation and summary of who we are. I will say that what I will share is that Lauren has always been pretty active in her healthcare, and it's something that's been really important to our family. And so we certainly are excited to share kind of our experiences so far and offer, advice and information for how we navigate this process.
I agree. Great. Yeah. Great. And Lauren, I can imagine many things you'd like to be doing on Friday afternoon. So we appreciate you doing this. So I'm going to just start right in, if that's okay. My first question for both of you is, at what age do you think parents and youth should start talking and thinking about healthcare transition?
So you want me to start? Yes. Okay, I'll start. So for me, as a parent, I wish I would have started at, 7. I don't know. Early. I think that there are little pieces of healthcare that children are able to learn and are able to engage with, even at an early age, even if it's just understanding, why are we going to the doctor? What is it that we're going to talk about? What are you feeling in your body? How do you convey that information, even at a really young age? But definitely by the time they're hitting 13, 14 years old, that's going to be really critical for them to take a much more active role as they're moving into, adolescence and that transition process. What do you think?
Although I do think that's true, that starting off at a younger age is good. I still think that you should start off later, because even if you do tell the child when they're at the age of 8 or 9, there's probably a big chance that they're not going to pay that much attention to what you're really saying. Saying, "Oh, I'm going to the doctor," and they will I don't really see a child paying that much attention to the reasons why. So at an age I would kind of bring the child into it is at 15, 16, because that's around the time it's getting closer to the age of 21 and 18 in those years. And I feel like it's more important to do it closer to the date than having doing it earlier, and then you have to keep reminding them about these skills. So that's kind of my opinion.
That's great. I think you can see the parent and the child have a little different perspective, but always I think the notion of earlier is better. What information do you feel like you need to know to confidently handle your own care? And maybe I'll direct that one to Lauren.
I feel like the information I need to know that's more important to me is being able to tell the doctor what I need and being able to tell the doctor, like, what part of me, like, isn't feeling well, and knowing, like, what certain feelings are normal and what feelings aren't normal. Like, it's kind of a thing that most people see as, like, an automatic thought. But for some people with, like, neurological disorders or things in that manner, they can't tell, like, what is normal, what is a normal feeling, and what is abnormal, and being able to tell the doctor, I'm feeling these things, and the doctor can take that and decide what, like, medications you need. So, like, if in a doctor's appointment, you go in, they find out that you have, let's say, like a cold. After that, the doctor can tell you, these are the reasons why I felt like you had a cold. And being able to tell that patient, okay, if this happens again, this is what you need to tell your doctor so they can give you these resources.
That's really helpful. I wanted to just, it sounds as if you've had some experience talking to your doctor directly during your visits to the doctor. I'm wondering, how often does the doctor talk to you directly and not to your mom?
Probably in the past year, they started talking to me more directly, like asking me what are my medications, what are these things, and having me have to remember what my medications are, and having me remember, like, what treatments I've had in the past, instead of just asking my mother. But it's only been in the past year or so.
And Elisa, how does that make you feel when the doctor's talking to Lauren or seeing Lauren on her own?
Yeah. Well, so I would definitely say there's two feelings that happen, right? So the first feeling is kind of fear. Is she going to be able to articulate what's happening? Kind of to her point, is she going to be able to express, you know, what it is that her needs are? A lot of times in the past, I've filled in that gap where I've been able to interpret what it is that she shared with me at home. But the other side is a little bit of relief, because there is going to kind of come a time where I'm not going to be in the room and I'm not going to be able to be there. And so seeing that they're engaging her and her building her confidence and being able to speak to them about what her needs are, what her past medical history is, what she's experiencing, understanding what her medical needs are and the processes to getting her medical needs met, it gives me a little bit of relief. So there's this tension, right? It's hard to let go, and it's like, okay, can they do it on their own? But to see her often rise to the occasion and be able to convey that information is a point of pride for me, and relief of, okay, eventually she's going to have to do this, and she can do it.
I can imagine, Lauren, you can see the empowering feeling that it gives you, but the tension from a parent's perspective of the letting go. I have another question here about what information and guidance from your doctor would be helpful in planning for transition. Either one of you can start in on that.
You want me to start? Yeah. Okay. So I have my number one piece is, what doctors will she see when she's no longer in the pediatric world? There's a team of doctors that we have cultivated, put together throughout her life for her medical needs, whether it's for her asthma and allergies, her gastrointestinal, her primary care, her, any mental health, psychiatry needs, anything like that. She's developed a team that has gotten to know her. And what does that look like in the adult world, right? And who are those adult doctors that are going to be able to provide each of those services. The other piece that goes with that is, again, many of these doctors she has seen for years and years. For her pediatrician, she's seen her pediatrician since she was 2 years old. And so to take that information and convey it over to an adult provider, what does that look like? It feels overwhelming as a parent to say, how in the heck are we going to, let the other professionals, the adult providers know all of this history and all that has happened. And so certainly assistance with whether it's creating a summary or some type of transfer of information that's much more succinct than the very thick file or electronic documents that exist for her. And then what do the specialists look like in the adult environment? I think are my two big things.
Mm-hmm.
I definitely agree. Like she said, I have had the same pediatrician since I was 2. I know her, like I walk in the office, I tell her one thing's wrong and she knows what's going on with me. It's kind of like I'm not used to going back to the point being able to say what's going on with me and what do my feelings mean, because I've had some of the same doctors since I was a child, little. I am still a child. You're a youth now. I am a youth. So that really scares me. Like the thought of having to create this whole different team for all of these different things, because like going to the doctor is very important. You have a very large team of a lot of different people in a lot of different parts. And if one of the parts doesn't know what's going on, then it all falls apart. So kind of what I'm scared about is people not knowing enough information. I'm not worried about their ability to make sure that I'm healthy. My worry is, like she said, being able to go through this big file, because it is a big file. And it's like whenever, like, for example, whenever we go to a new doctor, we have to tell them all of this history. It takes up half the doctor's appointment. And then there's not that much time to do, like I said, and teach different ways to talk about health. And there's not that much time, but I feel like there needs to be more of a effort to get the history before the appointment.
Those are great suggestions. I'm wondering, have you actually received any transition planning help from your current, either your pediatric doctor or other healthcare providers?
No, not at all. It's mostly, the most things I hear about transition are from my own mother. So,
I can believe that.
It's a topic in our house, but what we hear often is, oh, well, she can stay in our practice till she's 23. And it's almost a putting it off, and I often have to press and say, okay, I get that. However, these are some things that, we need to do. So, almost, pushing in with the information and knowledge that I have about healthcare transition. But often the office staff and even the doctors within the practice, they're like, oh, she has time. She can stay here till she's 23. We'll take care of her needs, no worry. But not understanding the earlier you start the process, the easier the process is going to be.
Well, I think that your experience is like the majority of people in the United States, that we know that about 85% of parents say that they haven't had a conversation with their healthcare providers. So this is we've got a big lift, and I think some of the, how would you say, the nervousness that you feel about making change often makes you want to put it off. So I think it's, and if it's not being proactively offered by the doctor, then it's not so much in front of you. So you mentioned some of your concerns about changing from a pediatric doctor, where your mom had a big role to play, to going to an adult doctor where you're going to be more in in charge. I'm wondering, you made the comment about the information and your history, and how that's a little concerning that the new person's not going to know you like your other providers have. Could you mention other concerns that you have, Lauren, or your mom has about making this shift?
Again, like the concern about knowing the history and just then be able to make the connections to what's going on with my health and how it's being affected by the environment that I'm in, and for me to be able to communicate that to the doctor, because usually it's like my mother trying to make that connection to the doctor about how the environment is affecting how I'm feeling. And also just be concerned about starting with new people. Like, meeting new people is not my biggest strength. So starting with a whole new team of people that are supposed to be taking care of my health is scary. Mm-hmm. So I think just like being able to meet these new people even before you're out of the pediatric practice, like just having that appointment, like not even like as a well visit, mm-hmm. meeting these new doctors, because starting with a whole new team is a lot. Like, you're meeting a lot of new people. And yeah. I know I'm probably not the only one that feels mm-hmm. like it is difficult to meet new people. Mm-hmm. Mm-hmm.
Yes, I think that you know, I hear from doctors who are receiving new young people how they too feel it's hard to establish a connection right off the bat, and mm-hmm. and with young people, if that connection is not established, everybody gets very frustrated and disappointed, and we don't want to lose you from care. So helping to make this bridge work is really, really important, and your advice is really helpful. Elisa, I wonder if you wanted to add any thoughts about that.
So, you know, it's, as Lauren has articulated, it's unnerving on her side and on mine. You know, but I think one of the pieces that I would like to see is that there are other options, right? Eventually the goal is for her to be able to handle her medical care on her own, but making sure that we're doing it in a smart way that uses supported decision-making models and knowing that those are available, that she doesn't have to always be in there by herself if that's not her desire or her comfort level right now, and that being something that is honored and respected even within the adult practices, that just as it is in the pediatric practices. Of course, with paperwork in place and all of those legalities that need to happen, but really embracing that versus, you know, feeling a sense of resistance, I think is the bigger concern that I have. But, you know, and I would really be looking for, and we would be looking for a provider that would be open to that process of, you know, her being allowed to have the support that she feels like she needs, mm-hmm. as long as she feels that she needs it. Mm-hmm. Yeah.
Well, I think you've given many suggestions here about how things could be improved upon and how this transition should be planned earlier, planned together, and that the switchover should be thoughtfully handled with a lot of careful attention to communication, to relationship building, as you said, to shared decision making. I'm wondering, just in closing, if you have any other suggestions you might want to offer your pediatric doctor or adult doctors to make this change easier.
I think, and it's interesting, you know, as Lauren said, we talk about this all the time. So this is not an unusual conversation for us. And one of the things that we talked about was really building time in for transition in every appointment. Like, it really is key, making space and time for that to talk about it. And certainly, you know, the amount of time needs to increase as the youth increases in age. Because it's something that is really important. And from a parent standpoint, we put healthcare at the center of our household, and we've made it very important, and her health is very important to us. And making sure that that's continuous as she starts to make her own health choices. And I think having those conversations about what that transition looks like and building that into her well visits, I think is going to be important to help her see the value of it and sustain that engagement in healthcare as she moves into greater independence.
I agree. I just think also just, like I said before, being able to see the new team while also still working with the pediatric system is very important. And going back to what you said about having the parent still in the room, even if you're not in the pediatric system anymore. Like, I know I personally, not yet, feel like I want to be in a doctor's office by myself with just a doctor. I like for my mom to be in there, not just to just sit there and be there. So if I do have any questions, I can look over and be like, hey, Mom, what is this? And being able to do that without having any, like you said, tension from the doctor is very important from like a youth standpoint.
Yes. Well, listen, I just want to say to Lauren and Elisa, you're been so insightful about this, and I know it's going to help a lot of youth and parents. It will also help a lot of providers, and it will help people like myself who run programs on transition. So I really, really thank you for sharing your story today and offering your wisdom.
Thank you for having us.
And I'll turn it, I guess, Frank, or Ann, if you could forward the next set of slides. So I wanted to just say that the exchange that we just had with Elisa and Lauren, we have at Got Transition some resources that we think can help support other youth and parents and other pediatric and adult practices to help with the transition. So our website is Got Transition, and as you've heard, we're a clearinghouse, and we have sections on our website for health professionals, for youth and families, and for researchers and policymakers. And if we could go forward onto the next slide. In particular, I wanted to share some resources that we that are part of the what we call the 6 core elements of healthcare transition that have been customized for youth and young adults and caregivers with intellectual and developmental disabilities. And these are available on our website. But briefly, what we're trying to look at is how important and confident a young person is in taking care of their own health care and getting ready for the switch to adult care. And then we have a set of questions asking about what you know about your health and what you know about using health care. So the intention here is over the course of adolescence, starting at around age 14 and continuing regularly, the practice would be asking the young person these questions. And we presume that these questions would be continued into the adult practice, as we recognize that even 40-year-olds often don't know the answers here. So if we could turn this next slide, please. So here are the resources for the transition readiness assessments, and we also have a medical summary and emergency care plan. I think you heard from Elisa and Lauren the desire to have their medical information in some concise source, and this is a sample that could be used for youth and families. Next slide, please. So we have on our website several other resources that might be of use to you. We have a one-pager that's a set of questions to ask your doctor about transitioning to adult health care. And so we have the similar set of questions for youth to ask and for parents to ask. So, for example, at what age do I need to change to a new adult doctor? can I have a copy of my medical summary and emergency care plan? When I turn 18, what changes will happen in my health care? So these are a set of questions you could begin to explore with your doctors. We also have something called integrating young adults with autism spectrum disorder into your practice. And these are actual tips for adult doctors about preparing their staff and their office for better serving young adults with autism. We have in this resource, we also have what should happen before the visit, during the visit, and after the visit, and suggesting specific accommodations. In addition, we have a one-pager that explains some of the differences between pediatric care and adult care. Oftentimes the presumption is the same type of care that you received in the pediatric setting is what you're going to be receiving in the adult setting. And the systems are quite different. So we wanted to share that. Finally, we have a one-pager on turning 18 and what it means for your health. Next slide. In addition, I think I mentioned in 2018, the major professional organizations of the Academy of Pediatrics, the Academy of Family Physicians, and the American College of Physicians came to consensus about what should be taking place as part of healthcare transition support. And they encourage this transition support to happen starting at around age 12, continuing through young adulthood. And they also called for the use of this approach called the 6 core elements. So here is a link to that clinical report. And then as part of our youth and young adult advisory group, the young people asked to have more of a fun quiz. So in English and in Spanish, we have this fun quiz, and I took it in advance of this call today and pretended I was one of my children at the age of Lauren, and after answering the questions, the answer was you still have some more work to do. It looks like you may need some help with taking control of your health as you transition to adulthood, but don't worry. Healthcare transition is about self-advocating for yourself as you grow up and become more independent. Knowing that you still have planning and work to do is half the battle, and then it directs you to some tools. So anyway, I hope this is helpful to you, and I think at this point we're ready to answer any questions.
So this is Anne. I have a question, and it has to do, I guess, with what you talked about before about advocating for oneself or one's child. So would you encourage youth and/or parents to bring these resources that you're mentioning to the attention of their doctors if the doctors aren't proactive about using these? Would that be a good idea?
I think it's a great idea, and I think that the notion here is you want to form a partnership with your pediatric doctors and other pediatric providers to work together to prepare for this transition. So I think, we don't want to be, how do you want to say it, totally annoying to the doctor, but at the same time, we are trying to improve our preparation and building the capacity of the young adult and the youth to be better able to advocate for themselves. So I think it is a conversation, and bringing these tools to the practice, I think is a great idea.
Great, thank you. So while we're waiting for people to send in their questions by chat, I have a couple of questions that came in another way. One is, what kind of training or other things should I look for when looking for a new adult care doctor? And how can I find out if they have experience taking care of autistic adults?
I'm going to see if Elisa might want to answer that one.
So From our standpoint, because there are some of her doctors that we've had to actually transition just due to the movement of doctors and things like that. And so what we've ended up having to do is not necessarily looking for particular training, but really the openness of the doctor to learn about Lauren's needs, because, you know, without the cliche of you seeing one individual with autism, you seeing one individual with autism. So what's important to us is that that provider is open to understanding what her needs are, how best to work with her. We have a doctor, for example, that Lauren has a really hard time with shots, like many people. And he, you know, worked with Lauren to teach her some strategies on how to get through that. And also, Lauren was able to advocate with that doctor to say, can you do it at the beginning of the appointment? I know that I'm getting shots. I know that this is going to happen. And because of that, I don't want to keep perseverating or thinking about this over and over again while you're trying to tell me something else, and I won't be able to hear you. So, you know, I think the big piece of training for us is that they're open to listen to what her unique needs are than any skill in particular that they may have.
Mm-hmm. I'd also like to suggest that sometimes there are multiple providers that one has to transition out of pediatrics to on the adult side, but we always encourage to at least start with finding a primary care provider on the adult side, and they often have connections to other specialists. So, and then the other suggestion is to allow enough time for this planning, because, you know, the first provider may not be a perfect match. And we do know that there is a shortage of primary care adult providers in the country. So allowing enough time is important for this transfer.
Thank you. And that sort of leads to another question that came in. What if I go to a new doctor and it doesn't go well, or I don't feel respected or understood? What should I do?
Again, I'm going to turn it to Lauren or Elisa on that one.
So I approach healthcare that I am and I like to use these terms, I'm a consumer of healthcare and not a receiver of healthcare. So in the past, we've kind of gone in, it didn't work out, but we kind of took what we got and said, okay, but this is the closest doctor and we're going to just deal with it. Versus now we definitely take a viewpoint of we are consumers, which means every provider may not be for Lauren, for somebody with autism. And we have to be honest and first try, of course, to work with and express what our needs are through advocacy. But if it may come down to this, that the personality of that provider may not match. And I want to definitely encourage parents to feel like they can be consumers, true consumers of healthcare, and make choices to say, you know what, this may not be a good fit for me. It may be a good fit for a lot of people, but it may not be for that particular person, and feeling okay about making that choice.
Thank you. That's great. So we see that somebody has provided some info on the chat. It's not a question, so I think we'll let people read the information themselves. There's another question. Can anyone share thoughts on transitioning to college and receiving services in the college health system, factoring into college selection, et cetera?
Yes. I think that's another great question. What we have found, we've had a lot of conversations with college clinics, and what they're telling us is that while the immunization records of the students, incoming students, are coming in. They don't really have much in the way of medical records. And so, again, we strongly encourage when youth are in their senior year of high school, if not a lot sooner, that they should be receiving a medical summary that they can share with the college or the next provider they're going to. And I think that we also have been doing some work with some locally with school mental health programs, and they have, in the school mental health programs in DC, have been putting together a wellness discharge plan, which is done with the youth so that they have information about their diagnosis, their medicines, their triggers. And again, they have been working with the students to look at the colleges they're going to identify what mental health services are there, what access they might have in terms of psychiatry or other services. So the planning that needs to happen, I can't underscore how important this is, and we just know when there is not a process in place, too many times young people fall through the cracks and land very hard. So we're just trying to put in place a process that can hopefully work to maintain continuity of care.
Thank you.
And Peggy, this is Elisa. I would absolutely agree with you. I just want to say, Lauren and I are knee deep. Matter of fact, today is college decision day for finding out if she got into university. So we are we are knee deep in this process. And it is something that is at the forefront of our minds of what's available around the school. Are there medical providers that we can tap into, talking to her current providers about that? How do we keep continuity of care? But also, what do the health centers look like? What therapy is available on campus? And we are very open, and again, to Peggy's point that, providing them with a summary of what her medical needs are while she's there on their campus, and that informs kind of how they, so that they know how to address her needs when they arise. And some schools are better than that at that than others. And certainly having those conversations early and often should be something that's factored into deciding on which school to go to.
Mm-hmm. I also want to mention we were listening to a panel of seniors in college, and they were asked what were their plans when they're going to leave the school, because they relied on the school clinics. And there were 6 kids on the panel, and none of them had a plan about how they were going to, where they were going to receive their adult care or how they're going to stay insured. So I think, again, it's something that we all need to attend to, whether or not it's, in your high school years, going to college, or if you're going on to just from leaving pediatric care to adult care in your own community. Anyway.
That's great. So I'm going to read a message that came in. It says, providers can learn more about autism and primary care through the ECHO Autism model, which provides training on autism as co-occurring conditions, as well as managing successful visits. I'm happy to share more about this if you like. So I guess, yeah, and so if the participant who sent that in would like to send in a link or something through chat that everyone could see, that would be really helpful. Thank you.
Thank you.
So, okay, here's another comment. I'm the parent of a child with autism and work in pediatrics currently. I was at the CAST program with Dr. Hanks prior and helped develop the CAST program with a strong focus on how to transition effectively from pediatrics. I'm on 2 ECHOs, focusing on pediatrics and transition for individuals with autism. Thanks very much.
That's great. And Dr. Hanks, Christopher Hanks, was the lead author with Carl Cooley on the report that I mentioned about integrating young adults with autism into your practice. I know he's done some fine work in this area. So thank you.
The one other question, we're running close to time, but here's a question that people might have opinions about. This says, I'll be moving to a new doctor for adults soon. Should I tell her that I am autistic?
And I'm going to turn it to Lauren or Elisa.
From my viewpoint, I've had this conversation many times. From telling schools I'm autistic, doctors I'm autistic, all throughout my life. In my opinion, I think you should tell the doctor that you are autistic, but tell them in a way that you're not saying the word autistic, instead of saying I have autism, saying I have these strengths and I have these weaknesses, and then go with my diagnosis of autism.
Terrific.
So instead of saying, go ahead.
I think that is a really wonderful advice. And on the medical summary that I shared with you, there's a space where it says, what information do you want the next doctor to know about you? And again, it's, as Lauren was saying, tell them about what things are important to you, what things you're concerned about. And I think that is an important information to convey.
Yeah.
Okay.
Yeah, and going about even if you don't want to say that you have that you have autism, again, just saying your strengths and weaknesses and saying the things that you want to practice are really what I think is important.
That's great advice. Okay, we don't have any more questions coming in through chat at this point, so Frank is going to close us out.
Okay. So we just want to thank again all our presenters, Sarah Beth McClellan, Lisa and Lauren Ware, and Peggy McManus. And many thanks to all of our listeners who joined us this afternoon on this webinar. We will be sharing the slides from this presentation as well as any other additional resources. When you signed up for the webinar, I know you provided an email address. So that's how we'll be reaching you and sending you the slides and any additional material. NIMH also plans to post this webinar, archive it, and post it on our NIMH YouTube channel for future viewing. And we'll reach out to you and let you know when that is posted. And again, we want to thank you for joining us and have a great weekend. Thank you.
Thank you, everybody.
Thank you.